Step up and become a part of something truly extraordinary. Throughout history, there has always been a powerful and unwavering voice that rises against injustice. The NAACP has been at the forefront of this battle, challenging discriminatory laws and leading powerful protests. Now, in this pivotal moment, it is more important than ever to join forces with this community of changemakers who deeply understand the issues that matter to us all. The NAACP is ready to tackle a wide range of urgent concerns in a nonpartisan and collaborative manner, from social to political. Don't let this incredible opportunity slip through your fingers. Join us for a live podcast that will leave you enlightened and captivated as we engage in a thought-provoking discussion with the NAACP and our allies. Get ready for an experience that will not only inform and inspire, but empower you to make a meaningful difference in the world.
Tonight is going to be a fantastic evening. We will be discussing some important community issues. However, please keep in mind that the opinions shared may not represent the views of the entire National Association of the Advancement of Colored People, NAACP. We encourage you to spread this information to your friends and family and let them know we are ready for an engaging conversation. Please feel free to comment and share your opinions as we welcome your participation in the discussion.
Good evening and welcome to Community Voices Podcast. I'm Hank Rogers, the first Vice President of the Jacksonville branch of the NAACP. Tonight, I am honored to have with me Jerry McMillan, Chair of the Healthcare Committee, been in the healthcare industry for over 10 years. One of the biggest problems that we're facing, not only in Jacksonville, but throughout the country, is healthcare. And so tonight, we want to have a conversation about affordable healthcare, Medicaid, Medicare, the difference, all tonight. And tonight, I'm honored for him to join us for this conversation to talk to us about the difference between Medicaid, Medicare, affordable health care. We'll be talking about as well deadlines, how to enroll, websites, you name it, all tonight's conversation. Mr. McMillan, thank you so much for joining me tonight.
Thank you. It's a pleasure to be here.
So tell us a little bit about yourself and how long you've been in the healthcare industry.
Well, my name is Jerry McMillan of the McMillan Agency, and we are focused on largely the needs of the baby boomer generation, but the entire family. And one of the things that we know about the baby boomer generation is that 10,000 of them on average are turning 65 every day.
Wow.
So that's a lot of people.
Absolutely.
And a lot of people to serve. And one of the issues with an aging population is as we age, we consume more health care. And so we have to be in a position to not be bankrupted by the cost of health care. And that unfortunately, leading cause of bankruptcy is medical bills. That's a travesty, a tragedy, and should not be. But we're in the system that we're in, and so we have to help people optimize navigating through it as we deal with our respective needs.
So we have a lot of uninsured baby boomers out there, would you say?
There are underinsured, there are uninsured. The underinsured population is largely under 65. But let me just back up and explain what is Medicare, what is Medicaid, what is affordable care. Medicare is health care for 65 and above, or people who are disabled and have been disabled for 2 years, or end-stage renal. So that category, if you think 65 and above is Medicare, you think below 65 is affordable care, affectionately referred to as Obamacare. Then there is Medicaid, and don't feel like you're the Lone Ranger if you get Medicaid and Medicare mixed up and use them interchangeably, but they are very different. Medicaid is health care for people who are extremely low income. And so that's administered through the state, 95% roughly funded by the federal government, but administered through the states. So each individual state has some nuances to their Medicaid. But the other thing that I'll point out that for people to understand is that you can have both Medicaid and Medicare.
And that was my question. Can you have both?
You very definitely
sign up for both?
You very definitely can have both. Many people who are on Medicaid when they turn 65 acquire the Medicare coverage, and that's you'll see referred to as dual because you're dually covered by Medicare and Medicaid, and it's a fairly extensive set of benefits, fortunately, for those who could not otherwise afford them. So that's the landscape, and then you have the medical care for underage for children. So those are the vehicles to access health care, and most of us fit into one of those buckets.
So tonight, we want to focus our attention on Medicare.
On Medicare.
And so talk to us a little bit about Medicare, and we have some deadlines and some dates approaching. So tell us about those dates and how we can sign up and...
Gotcha. The annual enrollment period for Medicare is October 15th through December 7th. All of those enrollments will be effective January 1st. Now, anyone who is eligible for Medicare already knows this because you get bombarded by mail, you get bombarded by intrusive telephone calls, you get bombarded by Jimmy J.J. Walker and football players. Now, who wants to get their healthcare advice from entertainers? That's a different question. But there is a bombardment of solicitations to get people to sign up, switch plans. They're relentless. They don't say no. They can't take no. I tell my clients, just hang up and just hang up and don't call the 800 numbers.
There's so many different plans, and they confuse, especially our older generation. So how do you walk them through which plan to select and what's the best plan for them at that time? Okay,
the primary determinants of what plan you're going to get is going to be driven by your medications and your doctors, your primary care physicians, your specialists. And so that's going to narrow it down.
So they got to be in a network? Is that what we hear about the network?
Well, there are, let me work my way to the answer to that. Okay. First of all, Medicare pays for 80% of Part A for hospital, inpatient, Part B for doctors and outpatient. But the net of it is Medicare pays for 80%. Now, the separate question of why they would set up a system that only pays 80%, you're guaranteed to bankrupt a lot of people with that other 20%. So write your congressman and tell them to make Medicare better. But it is what it is right now. It covers 80%. And so we have to have somewhere covering that other 20% to keep us out of bankruptcy when there is an event. So there are Medicare supplement plans. There are Medicare Advantage plans. Medicare supplement plans you pay for, and there's a range of them, but the most robust Medicare supplement plan basically pays that whole other 20%. You pay a monthly premium, and that's what you're paying for. There's also a Medicare Advantage plans, and just let me pause there to put a dimension on it. If you got Part B, which this year will cost you $170 a month, that everyone pays unless you're under a certain income level. If you're on Medicaid or some kind of assistance, that $170 premium for that Part B can be covered. Then you've got your Medicare supplement, which I think $200 a month, give or take. Then you've got your prescription drug plan, think as much as $100, $150 a month, depending on your age and what drugs. So you're quickly up at $500 a month per person. Now, it's just a financial reality that most two-person senior households don't have $1,000 a month to pay for their health insurance premiums. So the other alternative is a Medicare Advantage plan, which is offered by private insurance companies. You keep your Medicare, your Medicare never goes away, but that all of your health care needs are administered and paid by the insurance company who is paid by Medicare. Okay? Now, in Florida, fortunately, many of the Medicare Advantage plans have a zero monthly premium. and some additional benefits like your basic dental, your basic vision, fitness memberships. And so it's just a financial reality that about 60% of the people couldn't do the Medicare supplement if they wanted to because they just can't afford it. And so the Medicare Advantage is the alternative that allows us to not have that 20% exposure. You have copays. Many of them are zero copay for your primary care physician, a $10, $15, $20 copay for your specialist. Kind of like your cafeteria plans at work is largely how the Medicare Advantage works. So, and that's where the network comes in. Okay. The Medicare Advantage has a network. The insurance company has a network of providers. And so your earlier question, how do you figure out what fits? We have to examine where your provider, what insurance companies your provider is in network with, and your prescription drugs, what that is going to cost you across plans so that we can see which is most advantageous. And that process narrows the list down.
Because I know with a lot of our seniors, they're so adapt to a certain doctor.
Yes.
And so that doctor has to be in a certain network. And so yes. Can they switch from different plans or different networks to ensure that they remain with the same doctor?
Absolutely. And like I said, the number one consideration is where you get your health care. Because as you said, most people want to retain their healthcare relationships that right. they've had. A particular doctor knows them, they know their situation, et cetera. So if in the case of a Medicare Advantage, then we're going to start with what plans are your doctors in network with. Some of them you find one doctor in, one doctor out, this doctor in, that doctor out. But we've got to find one where both, and sometimes there are multiple physicians depending on the chronic conditions that you may have. And so that's the first step, is making sure that your physicians are in network with a plan. And then understanding what your monthly costs are going to be, because the cost of prescription drugs in some cases is crazy expensive.
So walk us through with our seniors who are afraid of technology mm-hmm. or don't want to sign up and they need some extra assistance.
Okay.
How would they get that extra assistance, or how would they get that extra help to make sure that they're signing up and they're doing it the correct way?
I'm going to give you an interesting statistics that will probably surprise you. I saw something that says of seniors over 65, low-income seniors over 65, 2/3 of them have a smartphone and are on Facebook regularly.
Oh, wow.
Yeah, that's a surprising statistic.
Wow.
But to your question, this subject matter is unnecessarily complex, convoluted, and confusing.
Yes.
Even for someone who works in it, it can be. So
and it changes every year.
There are subtle changes every year. And so I'd say that, first of all, as an insurance agent, I'm supposed to say the most complete source of information is at Medicare.gov, 1-800-Medicare. Okay? But I will say also that you are not going to get to know the people there. I advocate having a relationship with a trusted local agent who can walk through the information with you, whom you can call in the middle of the year and get the same person when you need help, when there's a claim. You may have to go to battle because the insurance company said no when it should be a yes, and appeal. Okay, so I'm an advocate of a local agent. I'm a biased perspective. I am a local agent, but I think you need that layer of help until this stuff gets more simplified, as it should be. I would not advise my mother, sister, brother to go down there without no help.
You have been the chair of the NAACP Healthcare Committee for quite some time. So how do you bring that expertise and that knowledge to the work that you do with the branch?
Well, they're to me, they're one and the same. It's the same intent. of getting people healthier. One of the things in our community is we have tended to use the emergency room as our primary care physician. It's terribly expensive, and the problem is by the time you get there, it's critical, chronic and critical. We've got to get our people to participate in the preventive portion so that you never get to the chronic, because and a doctor friend of mine says that 70% of what they treat is self-imposed. So if we can get our people to get a checkup and prevent something from happening, a screening that can prevent you from having late-stage prostate cancer that could have been caught and nipped in the bud.
That's good information.
Okay, so these are the things that we want to affect to make our people healthier and therefore more productive. And because we're living longer, and another statistics, 2/3 of the people my age will need some kind of long-term assisted care.
Got it.
Now, if we can approach our senior years healthier, we can be in the third that doesn't. My objective is to be in the third that doesn't. And preventive care, lifestyle, diet, all those things, the social determinants of healthcare.
Right.
We address those, and having health insurance is how we allow people to get the checkups, do the preventive things that keep us out of critical and chronic care.
So what should our message right now be to that baby boomer age, our seniors right now, open enrollment or the annual enrollment period, AEP,
Yes.
is right around the corner, October the 15th.
Yes.
So what should we be saying to them? How should we be encouraging them to sign up and get covered?
Many of the seniors already have their Medicare. If you're receiving Social Security, you will receive a red, white, and blue Medicare card in the mail.
Okay.
Okay. And if you're not at 65, you call and request your Medicare. Now, if you're 65 and still working on a job, you don't have to begin paying that $170 a month for Part B until you leave your job. You have what's called other coverage. And if you're still covered on your job, you do not have to start paying for Medicare Part B. Okay? When you turn 65, if you don't start enroll when you're eligible, there's a monthly penalty of 1% per month for every year that you did not. Okay? So that can, and the same thing with the Part D. There is a penalty with prescription drugs. So the message that I'd say to the seniors is get a recommendation of a trusted agent who can review your plan where you are. There are a lot of new benefits rolling out this year. And so each person should each year take a look and make sure that they have the best plan for them right now. Okay. Plans evolve, needs evolve. So even and for our clients, we actually start calling them in September. They set up the time so we can review, and then they start calling and setting up appointments so that when they start getting bombarded from everywhere, they can just say, we're good, we're good.
So Mr. McMillan, you are our chair of our health committee. We, of course, don't endorse here, but because you are our chair, and those who are watching, viewing us tonight, they may have questions.
Yes.
They may be listening and they say, hey, I watched that. I have additional questions. And they want to ask you personally.
Okay.
How would they get in contact with you? How would they get in contact with your agency to get their questions answered?
Okay, you can reach us at 800-420-4577. That's 800-420-4577. You can reach us online at alltherightplans.com because we got all the right plans at alltherightplans.com. Long to type in, easy to remember. In fact, I'm glad you asked that question. If you go to our website, the first thing that'll pop up is an opportunity to download Medicare Survival Guide. That is our publication that we produce, and it's a PDF interactive, so you can click through to certain agencies. You can It's got the phone numbers there, and it's interactive, so you don't have to carry around a big, thick book, and you can access it on your phone. You can access it from anywhere. So that's a resource. Again, 800-420-4577, alltherightplans.com. Give us a call. We'll gladly answer whatever questions. If we don't have the answer, we'll find it.
Yeah, because we have a lot that's happening as it relates to Medicare.
Yes.
With our seniors, and a lot of them, they get confused on Part A, Part B, Part C, Part D, how to pick, what to pick from.
And it is a vulnerable population.
Correct.
And the wolves are out. They're always out. And in fact, I had a client down in Titusville. She called me up. She said, Jerry, I got a bone to pick with you. I'm like, you changed my plan. I didn't change your plan. Some rogue agent, I don't know how they did it, but her plan was actually changed. We called the company, and they said, yeah, I see where he did it. And okay, well, we need to file a complaint against that person and get her stuff straight. So you really have to watch. You got to watch your bank accounts, people siphoning money out of your bank accounts. When it comes to health care, it's critical that, again, you have some advocate who can help you through the maze, not just getting signed up, but throughout the year as things come up. So
this has been helpful, and we appreciate you breaking it down for us, the difference between Medicaid, Medicare, affordable health care tonight. That's helpful, especially for our seniors as we enter this new season on October 15th, AEP, annual enrollment. The annual enrollment period will take place, and we look forward to you providing additional information.
We're glad. Look forward to it.
All right. Thank you for being here.
Yes, sir. Thank you.
Our Freedom Fund is a critical component of the National Association for the Advancement of Colored People. It was established in 1944 as a financial resource to support the organization's mission of fighting for racial justice and equality. The fund was initially created to help cover the legal expenses of numerous landmark civil rights cases, including the groundbreaking Brown v. Board of Education Supreme Court case in 1954, which led to the desegregation of public schools in the United States. The National Association for the Advancement of Colored Peoples legal defense efforts were instrumental in challenging racial discrimination and segregation laws across various sectors. Over the years, the Freedom Fund has played a significant role in financing other pivotal civil rights initiatives, such as voter registration drives, community organizing, educational programs, and advocacy campaigns. It has provided financial support to individuals facing racial injustice, enabling them to access legal representation and fight for their rights in court. In essence, the Freedom Fund has been an essential tool for the National Association for the Advancement of Colored People to combat systemic racism and promote social change. It continues to be a vital resource in the ongoing struggle for racial equality and justice in the United States. The Jacksonville branch of the National Association for the Advancement of Colored People will be having its Freedom Fund event, and we're asking the community to come out and support. If you haven't gotten your ticket yet, make sure to secure one and encourage others to attend. Supporting events like these helps provide the necessary resources for the National Association for the Advancement of Colored People to continue their vital work in combating systemic racism and promoting social change.
Tonight has been quite an interesting evening. We've discussed several important issues that concern our community in Jacksonville. We ask that you consider all the information we've shared as a perspective provided by commentators. No one has all the answers, but our goal is to dig deeper and find solutions. We invited the community to share their own views by emailing or calling us. We would love to hear from you. Have a fantastic night, and we hope to see you again next week. Please note that the information presented here represents the viewpoint of the guests and commentators and may not necessarily reflect the perspective of the local branch of the National Association for the Advancement of Colored People.
Welcome to the Inspired Network mobile app. To get started, simply on your iPhone or iPad, open the App Store app. Then, touch the magnifying glass labeled search type, the Inspired Network, in the search bar and hit return. Look for the app and tap the Get button to download it for free. Once the download is complete, open the app by double-clicking the side button. You can also tap the Open button after installation. To access the app in the future, simply tap the app's icon on your home screen and find the app's icon. Join us now on the Inspired Network and unlock a world of inspiration.
Are you in search of a sanctuary for your precious little ones? Look no further. At Harvest Time Christian Academy, we offer the ideal haven. Our passionate team, comprised of both devoted educators and compassionate caregivers, is well-versed in both biblical teachings and academic excellence. From the tiniest cherubs to curious toddlers, we are here to deeply enrich your child's life. Reach out to us today for further details. Rest assured, we provide flexible pricing options and a daycare experience that is imbued with nothing but warmth and affection. Together, let's create a nurturing environment for your little miracles to thrive.
Let the church say amen. K-Good Productions presents Gospel Fest 2023, featuring the Mighty Clouds of Joy. Saturday, November 18th at the Paxton Revival Center. See the Canton Spirituals. And the Swanee Quintet. Gospel Fest 2023, November 18th, 5 p.m. at the Paxton Revival Center, 5461 Commonwealth Avenue in Jacksonville. Tickets available at Eventbrite. For info, 904-813-0.
Hello, Queen. You know, someone once said life is 10% what happens to you and 90% of how you respond to it. Have you had some issues that you just maybe needed to discuss, or some things that you would want to share with someone but didn't have a place or a platform? The green room, the green room, the green room. The green room is that place where women come to share their ideas, their do's, their don'ts, their always, their nevers, their lessons learned. I'm inviting you to tune in every week to the green room. It's our place. The truth of the matter is, we all have greatness inside of us. You just need a little help to bring it out. It's me, Michelle G. Meet me in the green room.
Are you ready to kickstart your own online show? Have you always dreamed of broadcasting to the world on Facebook? Well, Inspired Television Networks has an exciting offer just for podcasters like you. Imagine having your show recorded in our state-of-the-art studios and broadcasted to over 50 million homes worldwide. And the best part? It's available at an unbelievably low price of just $350. This is truly a once-in-a-lifetime opportunity. So, join the revolution and become a part of our network today. Don't wait. Give us a call now, because we're actively seeking new programs.